The idea of PCNs is there's extra sort of funding that's been made available to provide extra staff to meet some of the challenges that general practice is sort of facing and meet the needs of patients in that sort of area. And that extra funding is being used by us at the moment to provide pharmacists, first contact practitioners also who are physios. We're looking at recruiting or re-recruiting a social prescriber, and we're also looking at mental health practitioners with support from our colleagues in the mental health services. That will be a very different feeling and experience for lots of patients, because obviously they are used to seeing a GP when they have any kind of problem. And as I say, that's something that we want from patients to understand, that just because they might not see the GP, it's someone who is obviously working with them, trying to help them, and the funding is available specifically for them. We have a significant proportion of elderly population, and while in many places that automatically leads to extra needs in regards to frailty and those kind of things, actually there's a significant proportion of our patients who are very fit and well in their who will be classed as elderly, whether they like to be or not. And I think that presents its own sort of challenges, because you can't just lump an 80-year-old with every 80-year-old, and therefore the needs may be different, and therefore the engagement with services may be different. And that is something that we're obviously trying to understand in ourselves and recognise. We are finding that we're about 40% busier than we ever have been before, and that's across the whole of the NHS, and waiting for problems because of the situation they've been in. So people who are coming to us are sicker than they were before because they've waited, and people have got more problems when they come, rather than sort of dealing with problems through the year. We're dealing with that. So we're finding that there's a pent-up need for patients, and that's something we have to try and manage and deal with, and obviously triage people in a way to make sure we deal with people in the most appropriate clinical order. And obviously recognising that pent-up need and managing it in a way that feels recognisable to patients and comfortable in the way they normally used to deal with things, which, as I say, things like online consultations, which was alien to us 2 years ago, was something we were trying to sort of introduce for those who needed it. And obviously there was a big change with COVID, is something that we're trying to deal with as well. And so obviously recognising who's the most appropriate and who's the best patients to use those things for is something that we're learning through. And obviously recognising the extra staff might be the most appropriate person. So if you have a medication query, does it go direct to a pharmacist rather than having to go through someone else? Obviously, as we move into the next stage of vaccinations and how we meet the pent-up need that I mentioned before, is going to be a tricky one. And having extra staff who can help support us with different specific areas for them will really help us be able to manage all those needs across all the different aspects of what we're asked to do, and help us understand how to develop services that fit patients' needs better, whether that be face-to-face, telephone or online. And actually recognising that different staff can do different things will be really helpful to us. And I know that's a change for patients, but that's something that we really want to understand what patients have to say about that, because at the moment I'm obviously sensing that people want to sit in front of a GP and see a GP, and that's what I grew up doing, that's what I wanted to do, that's what I got in a job to do. But recognising ongoing with the amount of need and the number of GPs, that's not a realistic model to continue with forever. So how can I make sure patients in my practice and across the network feel supported, feel looked after, I think is probably the best phrase, while being seen, not necessarily by me, but there's that ownership of care that patients really value in having a local GP, and I really value as a local GP. So it's making sure we can keep that. And that's one of the big sort of challenge, future sort of things we need to think about, is how we develop that. And we want patients to be involved in those kind of conversations. We've got the primary care network patient participation group, you've got your local practice patient participation group, and we want you to be saying, well, actually this is what we need. In our network we cover a big geographical area, as I mentioned, and so if we're going to provide services for physio in each practice, it may be that some things have to happen in different places, and recognising how patients feel that's going to work for them, how that's going to work for us as well as practices, is really important. We also want to look at prevention and how we can help patients not become frail, and the social prescribers being able to work with volunteer groups in the community, things to recognise what needs are and what we can help patients do to prevent ill health rather than being reactive. We can be proactive about things. That's something that comes with time and won't happen straight away, but is something we're really keen on across the St Helens Cares partnership, and one of the key priorities is about sort of maintaining wellness and trying to develop that resilience in the community so people feel that they're able to look after themselves when needed and know what to do when they don't and who to contact and how to get hold of people. We're also looking at medication reviews, which is one of the things we're asked to do in the primary care network, Des, and that's where the pharmacists are going to come in really helpful. So again, you get a call from the practice saying we booked you in the pharmacist. That's a network pharmacist, possibly, might be a practice one, but a network pharmacist who knows obviously a lot about medicines, can go through things in great detail and work with the practice, work with your local GP to be able to understand what's best for you and help you tell us what other issues, because again, within a GP appointment, to do all these things and go through everything is unfortunately impossible with the time we are allocated to do these things. So actually having someone who can spend that time on that is really helpful, and also using extra staff to look at sort of screening programs for cancer and those kind of things to try and really improve patients' long-term health rather than being reactive, as I say. And we want to work with other providers, the hospital trust, the local community, district nurses, practice groups, those things, to understand what we can do to provide services in the network in an area that works for patients, but also in a way that is about supporting people to look after themselves when appropriate and supporting them to know what care is available and how to get it, without that necessarily being automatically straight to the GP. For me, the key bit is people feel looked after by that GP. What I want people to do is feel looked after, feel that they're cared for by their practice, and that will look different and will involve different people, but I want patients to recognise that that will be under the umbrella of the practice, and that's where networks provide the funding and the staff to be able to do that. And I really think it's a great opportunity for patients and practices to work together to get things better for the future and provide an NHS and a GP practice service that is viable and that we can continue long into the future.